Hi, my name is Fatima. I'm biomedical engineer and I have PhD in ultrasound. In this session, I will present an introduction to ultrasound physics in second Copenhagen International Head and Neck Ultrasound course. This picture is how some of the earliest doctors across the world used ultrasound to image the human body between 1940s and 1960s. Initially, ultrasound machines were gigantic things, but now they have got very small. They have changed from these massive structures to really much more handheld compact devices, as you know. So here is an outline of what we will be talking about in the first part of this lecture. We're gonna have a little bit of history, then the wave principle, how to make an image using ultrasound waves. Then we will briefly discuss artifacts and also the transducer electronics. But what is ultrasound? They are sound waves that we cannot hear but help us to see. Isn't it fascinating? A normal human ear is able to hear sound with frequencies from 20 Hz to 20,000 Hz. The range of 20 Hz to 20,000 is called the audible frequency range. For sound below 20 Hz, the term infrasound is used, and ultrasound applies to all acoustic energy with a frequency above human hearing. Typical diagnostic sonographic scanners operate in the frequency range of 2 to 18 MHz. This is hundreds of times greater than the limit of human hearing. Of course, now there are transducers operating at 50 MHz to even 70 MHz, but typically the range is considered to be 2 to 18. Everything started with the theory of sound in 1877, and the first medical application was back in 1940. And here you can see the progress in ultrasound imaging. The image quality improvement over decades is clear here in these pictures. The first 3D ultrasound was back in 1995, and after a couple of years, we had 4D. And now there are enormous improvements with image quality, transducer electronics, imaging and beamformation techniques, and many other aspects. Nowadays, ultrasound has reached to super resolution imaging using microbubbles. This colorful image is a vector velocity map of a rat kidney. Just look at the scales. It is in fact only 2 centimeters wide, and we have so much vascular details in the image. Okay, let's start the physics with wave principle. As you know, sound requires a material medium. It could be solid, liquid, or gas. And sound travels more quickly through solids than through liquids and gas because the molecules of solid are closer together and therefore can transmit the vibrations or energy faster. Sound travels most slowly through gas because the molecules of gas are furthest apart. For sound waves, we have mechanical generation with 2 regions of refraction and compression. Compression is a region in a wave where the particles are closest together, and refraction, the particles are furthest apart. And this is the wave corresponding to the model above. But what is wavelength? It is the distance between any 2 similar points on the wave. It is the length of one complete wave, and it is denoted by a Greek letter lambda. Then we have amplitude. When a wave passes through a medium, the particles of the medium start moving. The maximum displacement of the particles from their original undisturbed position is called amplitude of the wave. And frequency, it is the number of cycles produced in 1 second. So here, for this specific example, the frequency is 2.5 Hertz. Imaging frequency is an important factor because it determines the penetration, which is the ability to pass through tissue, and resolution of the image. We will discuss it further later. Modern transducers allow us to change the imaging frequency within a certain range. Then we have the velocity of wave or speed of wave. It is the distance traveled by a wave in 1 second. And there is a relationship between velocity, frequency, and wavelengths. So you see for a medium with a fixed wave velocity, there is an inverse relationship between the frequency and wavelengths. So the larger wavelengths means there is a lower frequency and vice versa. Then resolution. We think of resolution as the clarity of the picture. Based on the center frequency of the transducer, we could have different resolutions. Here you can see two probes, a low frequency one and a high frequency probe. It means that over the equal time interval, the number of cycles in the generated wave by the first probe is less than the second one. Or we can see that the wavelength for the first probe is larger than the second one. Let's assume we have a small object in front of the low frequency probe. The object is smaller compared to the wavelength, and we can see that the wave just misses the object. So resolution was not enough to capture an image of this object. Then let's place the same object in front of the high resolution transducer. As you can see, the wavelength here is smaller than the object size. So the wave encounters the object boundaries and also the internal part of it. Therefore, we will see an image of this object. This means that a high frequency probe has a higher resolution and then can capture the smaller details. Now let's take a larger object, but put it further away from the transducer. You can see that the higher frequency does not have enough penetration to generate a clear image of the object. So always there is a trade-off between resolution and penetration. With higher resolution, we lose the penetration and vice versa. More technically, resolution is the ability of the equipment to detect separate reflectors and to display them as separate points on the monitor without merging them. Actual resolution distinguishes objects that are located parallel to the beam. They are in line with the beam. This type of resolution is particularly dependent on wavelengths, as we discussed in previous slide. You can see that the higher frequency has enabled discriminating between the 2 points, while with a lower frequency wave, we do not have two separate images of the 2 points, and it is visualized as a single object. Then we have also lateral resolution. Lateral resolution is the ability of the system to resolve two separate reflectors that are side by side or perpendicular to the axis of the beam. This type of resolution is dependent on the beam width, which can be narrowed by focusing the beam. There are different types of interaction between the ultrasound wave and the tissue. Attenuation is in ultrasound is the reduction in amplitude of the ultrasound beam as a function of distance. It is important because a reduced signal amplitude can affect the quality of the image. We have absorption. It is the reduction in intensity of the sound waves as it passes through tissue. Most of the energy loss is in form of the heat. Reflection in ultrasound refers to the return of the sound waves back to the transducer. This principle is what allows the image to be generated by the ultrasound machine. Generally, more reflection results in a more hyperechoic or brighter image. Reflection occurs at tissue boundaries where the tissue on either side of the boundaries have different acoustic impedances. Larger difference in the acoustic impedance results in more reflection. Scattering occurs when a sound wave strikes a structure with a different acoustic impedance to the surrounding tissue, and this object is smaller than the wavelength of the incident sound wave. Such structures are known as diffuse reflectors, with examples being red blood cells and non-smooth surfaces of the organs. Then we have refraction. It is governed by Snell's law and describes reflection where sound strikes the boundary of two tissues at an oblique angle. The reflections generated do not return directly back to the transducer. The angle of refraction is dependent on two things: the angle the sound wave strikes the boundary between the two tissues, and also the difference in their propagation velocities. Because here sound is not reflected directly back to the transducer, the image being depicted may not be clear or potentially altered. It is confusing the ultrasound system since it assumes that the sound normally travels in a straight line. Ultrasound imaging is based on the principle of wave reflection, which has several applications. To generate an image, it is necessary to send as well as receive an ultrasound wave. So there are two phases. First, transducer sends the ultrasound wave toward the tissue, and the waves strike the tissue boundaries. Then there is a receive phase. Here the transducer is in the listening phase and it receives the echoes coming back from the tissue. The received RF signals are then processed and being formed to generate an image and visualize the object on the screen. What is the grayscale then on the screen? It is the display of the ultrasound echo amplitude or signal intensity as different shades of gray. It means that different amplitude levels are mapped to a grayscale range. It is between 0 and 255. So overall, there are 256 levels in which 0 amplitude corresponds to black and the peak amplitude corresponds to white. So the gray level of each pixel in the ultrasound image is determined by the amplitude or signal intensity of the echo for that specific position. But we have also echogenicity. There is a terminology to be used when describing the appearance of an object when using ultrasound. There are 4 different terms to describe the appearance of the object. It is anechoic, hypoechoic, isoechoic, and hyperechoic. We must have a reference point to define echogenicity. In the neck, a normal thyroid gland is typically referenced as the isoechoic structure. Then we will see some examples of each term. Anechoic structure have virtually no echoes. An example here is the lumen of the carotid artery. These structures are frequently filled with thin fluid, and also cysts are a commonly encountered anechoic pathology. Another example here you can see is the fluid-filled areas of this complex thyroid nodule. Hypoechoic structures appear darker or less echogenic than surrounding structures. A parathyroid adenoma will frequently appear as a hypoechoic structure adjacent to the normal thyroid gland. The carotid artery contrasts the difference between anechoic and hypoechoic structure. Isoechoic structures have nearly the same echogenicity as the surrounding tissue. Here, there is a small isoechoic nodule with its superior and inferior edge defined by the cursor in this longitudinal view. And then hyperechoic structures appear brighter or more echogenic. There is a small inferior hyperechoic thyroid nodule in an otherwise normal thyroid gland in the longitudinal view. In this section of the lecture, we will briefly go through some of the main image artifacts. The first one, reverberations. It is ultrasound beam reflecting repeatedly between two strongly reflective interfaces in parallel, one of which is the transducer phase. Some of the energy of the first returned echo is reflecting at the transducer phase and acts like a second weakly transmitted pulse, which is again reflected back towards the transducer at the interface. The comet tail artifact is a novel form of reverberation artifact. In this case, the internal reflectors are very close together, so the reverberations cannot be seen individually, but appears as a diminishing tail behind the object. Here you see reverberations has occurred as sound waves bouncing back and forth between two highly reflective boundaries. This has resulted in multiple parallel hyperechoic signals that are equally spaced deep to the object. The tracheal wall frequently will cause a reverberation artifact. And reverberation artifacts can be improved by changing the angle of insonation so that the reverberation between strong parallel reflectors, so it cannot occur then. Ring down effect appears similar to reverberation artifacts, and although it may resemble comet tail artifact, but the mechanism is distinctly different here. Instead of closely spaced reflective interfaces, ring down artifacts arise from resonant vibrations within trapped air bubbles. These resonant vibrations produce a continuous, so decaying sound wave transmitted back to the receiver, appearing as a series of parallel bands. And here you can see an example of this artifact where you can see the ring down effect behind some bubbles. When sound waves pass through a poorly attenuating structure that allows them easy passage, there is less tissue reflection and an area of artifactual increased echogenicity produced right under the structure, because more sound waves are present in this area compared with tissues at the same depth around. So enhancement is a bright area deep to an anechoic area. This occurs because more of the sound energy passes through the anechoic object compared to the areas beside the anechoic object. It is typically seen with fluid-filled structures in a soft tissue background, like the cyst. Acoustic enhancement can help differentiate fluid-filled structures from solid or hypoechoic masses. And here in this example, the cyst is less anechoic, as you can see. So we have enhancement in behind. In contrast, shadowing occurs deep to a highly reflective object because there is essentially no sound energy that passes through. This is seen with high density structures such as bone and calcification. The example is a hyperechoic macrocalcification in the thyroid gland with a posterior nearly anechoic shadow. So there is a great impedance mismatch, which causes this high reflection and then shadowing in behind. Then we have the edge effect. The edge effect is caused by refraction in ultrasound tissue interactions. Here, the sound is bent at the interface of two media with different acoustic impedance. So here you can see we have two media. In the first one, there is a faster speed of sound, and in the second one, the speed is slower. Apparently, the first medium is then denser compared to the second one. So the sound refracts. You know, it is a kind of like Snell's law, like the way light gets bent as it goes from water to air, and you get it looks like a pencil is bent when there is a pencil in a glass of water. Sounds like the same thing, basically. We see this effect in cyst, vessels, and also bladder. The anechoic carotid artery in this image demonstrates this effect. As the sound waves hit the side wall of the carotid artery at a very oblique angle, there is essentially no sound wave reflected back towards the transducer, resulting in the black line deep to the side wall of the vessel. This combination of reflection and refraction at the edge of the carotid artery are the examples of the edge effect. Finally, we will check out the transducer structure very briefly. This schematic shows the main structure in construction of the working end of the transducer. The waves are generated by the piezoelectric crystals. So how do we generate a sound wave? We take a piezoelectric crystal, we put them in probe, and then we apply electrical charge to them, which causes a mechanical pressure on them. Now that causes these crystals to vibrate, and then they mechanically create a sound wave. Also, when an ultrasound wave hits this crystal, the pressure of the wave sparks an electrical impulse in the receiving function. This impulse can be used to generate an image. So these crystals are used to send as well as receive ultrasound waves in medical sonography. And also the crystal is sandwiched between a backing material and matching layers. The backing material absorbs the sound waves that are moving away from the footplate of the transducer. The matching layers facilitate the propagation of the sound waves to the patient through the footplate of the transducer. There is also an acoustic lens that focuses the sound beam into a small spot, increasing sensitivity to small reflectors. So thank you for your attention to the first part of the lecture. If you have any questions or further discussions or comments, please feel free to reach out to us.